Hi, this is Dr. Kant Shah here, Pediatric Robotic and Laparoscopic Surgeon. Today we are going to talk on a topic called Esophageal Replacement Surgery, also otherwise called as gastric pull-up surgery. This is a rare surgery which is done to replace the esophagus or the food pipe. In simple terms, the esophagus carries food from the mouth down to the chest into the abdomen to the first part which is called the stomach. So it's a connection between the mouth and the stomach, and it propulses or pushes the food forwards. Sometimes babies are born with a condition called esophageal atresia, where this food pipe is not completely made, and in most of these children, it can be repaired and reconstructed at birth. But in rare cases, this is not possible, and two stomas, which means openings, are made in the baby, one in the neck where the saliva comes out, and one in the abdomen called a gastrostomy, where the milk and eventually liquid diet is given to the baby for it to survive and thrive. Eventually, all such babies need a new pipe connecting the mouth to the abdomen, and this is called esophageal replacement or gastric pull-up surgery. Sometimes, unfortunately, children drink alkalis or acids which can completely corrode their esophagus. Such alkalis and acids are frequently found in floor cleaners and battery acids from tractors, etc. And if a child has drunk that, then they may get a narrowing of the food pipe. Most of the times, this can still undergo endoscopic management and we may be able to salvage the normal esophagus. But if the narrowing or the stricture is very tight or very long, then again, such children need replacement of the esophagus. So the two main indications for such surgery are when the esophagus is not made properly or it has become stricture and not responding to endoscopic dilatation. So what are the surgical options for such children? Well, we can recreate a food pipe out of three main organs. One is the stomach, the second is the colon or the large intestine, and the third is the jejunum or the small intestine. The stomach is the most well suited, and this is the commonest procedure done world over because the stomach can receive acid and it is the natural first step of digestion. However, the stomach is little big in size and few centers across the world instead use the small or the large intestine called the colon or the jejunum. This surgery is performed only in very specialized major centers across the world, and in our center at Borivali Healthcare, we prefer to do the gastric pull-up surgery where we use the stomach to replace the food pipe. Increasingly, we are doing these surgeries by either 3D laparoscopy or robotic surgery, which enables very minimal damage to the rest of the abdomen and chest and allows for a much faster recovery of the baby. Before such a surgery is done, the child needs to be of an adequate age and an adequate weight. Usually, children have to be at least 6 to 12 months old before we can do such a major surgery, and they should have good weight gain. The better the weight gain, we can wait a little longer to do this surgery so that they can tolerate it better. But sometimes, children who have tube feeds from the stomach may not be able to gain weight as these tubes cannot take solid food and only liquid food may be able to be given to the child. In such cases, we may have to do this surgery a little earlier. Also, it is advisable that all such children are given sham feeds, which means that whatever food is being given down the tube into the stomach directly, that same food is given in the mouth and then the child can spit it out, but their brain can correlate the taste of the food with the tube food. Because once the replacement surgery happens, the child may not have an appetite to eat if they are not used to eating food all the time. So for the few months that the child is on tube feeds, sham feeds are very important. Once we have decided that the age and the weight of the child is appropriate for surgery and sham feeds are being given, such a child can undergo this surgery. As I said, this surgery at our hospital, Borivali Healthcare, is preferably done and we use the stomach to replace the food pipe, which is called a gastric pull-up surgery. It is a fairly complex but safe surgery. The possible complications of such a surgery are that the space in the chest through which the stomach is pulled up may be a bit too narrow and there may be a difficulty in breathing for a few days, during which the child may be put on a ventilator. The joint that we make with the oral cavity and the stomach may leak or may become narrow over a period of time, although this is rare. About 20% children may experience vomiting after this surgery because the natural sphincter is lost up to 1 year after surgery, but eventually this resolves. With careful follow up, most children do very well after this surgery. The hospital stay is for 1 to 2 weeks after the surgery, depending on the healing of the child. And the feeding through the mouth usually starts about 5 to 6 days after the surgery, and slowly it is increased to full normal feeds before the child goes home. Children after this surgery usually grow and eat normally and have a healthy life, although some of them may need dilatations for strictures or regular monitoring. I would like to give you an example of one baby who came to us at 10 months of age with a weight of only 5 kilos. For some reason, when she was born with an esophageal atresia, her primary surgery was not done at another hospital and she was left with esophagostomy and gastrostomy. There was no sham feeds being given in her and only very thin liquids like rice kanji was being given to her through the tube feeds. Hence, she had not grown and she did not know what food tasted like. So, when she came to us, we realized that she is very malnourished. She is very prone to infections because of the malnourishment. She does not understand sham feeds. So, we changed all of this. We introduced a dietitian, and by 1 month, she had gained 1 kilo of weight and she had started understanding what is food and what it tastes like. Eventually, we had to take her up for surgery because she could not gain any more weight through this thin tube and she had already become 1 year old. She underwent surgery by laparoscopy and initially she had a good recovery, but she developed infectious complications through which she fully recovered and went home with good oral feeding. A year later now, she's able to eat and drink like her elder sister and she lives a good healthy life. So in conclusion, esophageal replacement surgery is life-saving when a normal repair is not possible. With modern techniques such as laparoscopy, better ICU with laparoscopy, pediatric anesthesia, and advanced pediatric ICU, outcomes are much better today, and parents should feel reassured that even though this is a very major surgery, children can actually lead a very healthy, normal life. Thank you. If you have more questions about this surgery, please do write them down in the comment section and do like and subscribe our channel. Thank you.